Welcome to the Salmon Runs YouTube. Enjoy the video.
You must stop and prioritize safety now. If you've been tempted to harm your sight, put distance between yourself and any tools or substances. Do not touch your eyes. Once done, protect the area with a clean shield without pressing on the eye and call emergency services or a licensed clinician for immediate instructions. Make sure to tell them exactly what happened and any substances involved, because accurate details will guide faster, safer medical response and reduce the risk of permanent damage. You should get evaluated by a qualified eye professional as soon as possible. Once you can, go to an emergency department with ophthalmology support or an urgent eye clinic and describe symptoms clearly, when they started, how they changed, and any exposures or injuries. Make sure to carry any medications, chemical containers, or relevant photos to help diagnosis. You'll likely receive imaging, topical treatments, or referral to a specialist. Cooperate fully so clinicians can plan the least invasive, most effective care for preserving vision. You must follow the treatment plan your care team gives you to maximize recovery. After initial care, attend follow-up visits, use prescribed drops or medications exactly as directed, and wear protective eyewear until cleared. Make sure to rest your eyes, avoid rubbing, and gradually resume activities per guidance. If you notice increased pain, sudden worsening of vision, new floaters, or discharge, return to emergency care without delay. That single step can prevent permanent damage and allows clinicians to.
Thanks for watching. Consider subscribing if we helped you.